You are listening to The Dish on Health IT, brought to you by Point of Care Partners, a leading health IT consultancy. Each episode will feature a rotating panel of senior consultants and guests who will talk about trends and innovations in health IT, while also highlighting how organizations can leverage these advances to solve their business problems. Today's episode is our year-end special. Host Senior Health Information Technology Consultants Gary Austin, Jocelyn Keegan, Ken Kleinberg, and Pooja Babbrah face the end of a tumultuous year with an upbeat perspective on the good things that have been accomplished in health IT this year and offer a positive outlook on what's coming in 2021. We hope you find today's episode helpful and that you'll share your topic ideas with us by emailing us at podcast@pocp.com.
Good day, everyone, and welcome to the ongoing adventures of The Dish on Health IT. I'm your host, Gary Austin, affectionately known as Lumpy. We at Point of Care Partners are health IT consultants with 100-plus associates in over 35 states. We work across all stakeholder groups, payers, healthcare delivery entities, pharma, health IT vendors, HIEs, and government agencies. And we're viewed as an independent, trusted party, the Switzerland of consultancy. With me, joining me today for our year-end episode of The Dish is our new technologies lead, Ken Kleinberg, our PBM practice lead, Pooja Babbrah, and our payer lead, Jocelyn Keegan. So welcome all, and thank you for joining us. We thought we'd wrap up the year here with a little celebration and some prognostications on the year ahead. First, I'd like to wish everyone a safe and more important, a healthy holiday season. This one is certainly the strangest one in my lifetime, and I think we'll all be so glad when we're over the hump on this COVID pandemic. So everyone stay safe out there and remain isolated and be healthy. So I think as we move forward, what I'd like to do is I went back and called through some of the video we did over the year here, some of the podcasts we did throughout the year with our various guests. We had some great guests this year, right? We were really fortunate in terms of that. I called fuller topics that I thought we could weigh in on for 2021, no particular order. Impact of COVID, technology innovation, a lot going on there in healthcare, health data, and price transparency. And then I thought we'd finish with a little bit of thoughts on the new administration coming in and where CMS may head and whatever else going forward. So let's start off with the elephant in the room, the ongoing impact of COVID. So Pooja, we'll have you kick us off here. So aside from the obvious, how you're going to get 300 million people to your neighborhood CVS to get a vaccination, what are your thoughts on the impact of the healthcare vertical that COVID's going to have in 2021? Thoughts?
The whole question about COVID and I think it's going to impact a lot of things. Just even starting with the vaccine and the vaccine distribution, right? It's been a topic I've been kind of following a couple threads on Twitter over the weekend, and the first doses that are rolling out are actually in. You have to take 2 different doses for it to actually be effective, and so if you think about kind of the clients that we work with and the folks that we work with, starting with HIEs and being able to even track, the immunization, right, of all these people that we have to get immunized next year, being able to track whether or not they got their first immunization and then track the second one. I think, adherence plays into some of this as well. Making sure that folks that have gotten a first dose are actually going back to get their second dose. And, even the payers and pharmacies are going to be impacted by COVID, not just with the vaccine, but also with, how folks are seeing their doctors. We talked a lot about telehealth in the past. We've talked about pulling pharmacists in to do these vaccinations, community pharmacies. We're talking a lot about the retail pharmacies and how they're getting kind of looped into this plan, this Operation Warp Speed plan. But what about the community pharmacies? Last Friday, I think it was, NCPDP released their guidance on reimbursement for the vaccines. And I think it's important to be thinking about the community pharmacists and the role they can play. So I think COVID in general has kind of changed a lot of things around technology and healthcare. I think the rise, the coming back of the HIEs, I think the opportunity for community pharmacies, and then just the whole thing around telehealth and payers, I think we're going to continue to see into this next year.
Very good. Some good thoughts there. Jocelyn, anything you want to put onto that?
Yeah, I think that sort of building on what Pooja said, from a point of care partners perspective, we're in this unique position, right, that we straddle pharmacy and the medical side of the benefit world. And I think that Pooja's points about really making sure that people drive volume in this market to the best place that can most ably serve a patient and have the right tools and connectivity to ensure that that data is comprehensively gathered is great. But I think that to me, I think that there are two things that I think call out that are going to, as we go into 2021, that we're going to continue to sort of have to grapple with. And the first is, really just the impact on the P&L from a provider organization standpoint, right? There is massive loss happening, for our colleagues that are in the direct line of care. And to Pooja's point, leveraging the pharmacy and making sure that as we figure out how to get all of that suspended care back in motion, as people deal with second and third waves of, discretionary or non-urgent care being delayed, how we best sort of monitor the market. So I think for me, when I think about what we look at 2021, it's really understanding how people are best leveraging the tools that are in front of them today, I like to refer to it a little bit of a silver lining, how we take advantage of some of the new tech that's finally being laid down as we reckon with the fact that we've been willing to tolerate all of this lack of data sharing to date. And then as we get further into the conversation today, we can talk about impacts, right, of almost this market readiness to really say, we wanted these rules to go in place. You've now put delays on the rules. Does that slow us down when we were at sort of a point in time that we could have had the perfect storm to push through a lot of technology change? So watching the industry sort of grapple with how fast do we allow ourselves to move? How much do we acknowledge what our provider teams are dealing with? And then I think the third piece is for the vendors and the payer community really seeing sort of the delayed impact of those care impacts start to echo through people's P&Ls on the other stakeholder side of the market as well.
Good thought there around P&L. I could see this being very problematic. I talked to some friends over the weekend, and 3 or 4 friends, and they all have pending services, right, that they put off because of COVID. And they're like, once I get vaccinated, like I'm ready to roll.
Well, and I think that everybody in their household probably has people that have put off 1 or 2 things that they should have done this year that just didn't have to be done. And I think the other interesting point that I've heard a number of folks on the payer side talk about sort of, this move towards value-based care and people going more at risk with each other and keeping each other whole during this insane year. Also the impact of the actuaries inside of the payer organizations. Everybody thinks the payers have done great, but the actuaries now really starting to understand and start to forecast what happens when all of these people that are unemployed stay permanently unemployed or stay unemployed through open enrollment and start to drop off of COBRA and start to drop off of commercial insurance, and what's the P&L impact to the other side of the house as we roll into 2021 and people are really looking at what their budget in 2021 really looks like given sort of that math.
Do you see a big potential burst here with the ACA products, the retail insurance products?
I mean, I think it depends what happens, as we get through the next 2 or 3 months, from a legislation perspective, from a Supreme Court perspective. But, I think that we'll see, early nods from the new administration on sort of where they're placing their bets there on pushing forward and continuing to expand and extend. Really, we've been in stasis for the last 4 years around ACA. So it'll be interesting to see what happens sort of as we roll into 2021 with the new administration.
Got it. Ken, final thoughts on COVID?
For me, the vaccine is going to be so key. And I read something that was a little bit troubling recently. It correlated the degree of someone's education with their willingness to take the vaccine. And generally, you had an advanced degree, you were the most likely to want to take it, and you work yourself down to less than half the people who didn't have that educational level not willing to take it. So there's a big trust factor here and a big education factor that the payers, the providers, IT vendors, all of us really have a responsibility to help with that.
Good point. I read some stuff actually this week and on racial divide too, around vaccination too. So it's not only social, not only economic, but social also, and things. Okay, let's leave that topic for a sec. Let's move over to the health technology space. So we did podcasts this year on 3 key technology topics. We talked about telehealth. We talked about FHIR APIs and the accelerators. Actually did a couple podcasts on that. And we talked about health information exchanges, or HIEs. So all 3 of them had explosive years. You know, telehealth is now de rigueur, starting point for patient triage and diagnosis. The FHIR accelerators are really taken off, especially Da Vinci and Karen and Gravity. A few more new ones coming online, Vulcan and Kodak and things. And the HIEs have become a key partner in the public health response to COVID, right? Seen a lot more things being done with HIEs. So what are your thoughts as to where these technologies are going in 2021, maybe into 2022? Is it more sort of just more of the same, or do we see some, explosive changes coming here and stuff? So Ken, you're our new technologies lead. Why don't we start off with you on this one?
I can start on that. First, it occurred to me, what are these technologies that you were just describing have in common? Well, they're connecting stakeholders together, providers, patients, payers. We've experimented, we've piloted, we've had our successes, and less so with telehealth, with interoperability, with health information exchanges over the last 2 decades. We're now seeing them all come together and go in mainstream. And whether this is driven by leadership of certain organizations or via regulation, or perhaps the relaxation of regulation in the case of telehealth, in limiting what can be reimbursed for, or frankly, just this need to fight the pandemic. Sometimes I think it takes a major event or this catastrophe of COVID-19 to drive us forward and make the old excuses, frankly, seem lame. Now, once data starts to flow, we have the opportunity to run advanced analytics with more varied data sources. And this can inform decision support. It can inform risk stratification, analysis of social determinants of health, precision health, and so forth. So I'm particularly excited about the promise of natural language processing, AI, machine learning. My son is in college now. He's working with machine learning in his biology engineering work and loves it. My daughter's taking courses on the ethics of AI. So I think this is going to be a very key technology moving forward. I think we're in for, if not an intense year, for sure, an intense decade.
Very good. Pooja, thoughts there?
Yeah, I just want to kind of play off what Ken said about, all these new technologies. You're essentially connecting people together, right? You're sharing more information. And that brings up another word that he mentioned earlier, which is trust. So to me, there's a whole framework that we haven't really been talking about, which is 2 things. One is you're starting to open up more data, right? And so we have HIPAA, of course, which goes across our business entities, but what about when you open it up to the patient? So I think, having this kind of trust of applications that are now going to start flooding the market for patients to get their information, but then also, who are the patients willing to share the information with? And so I think, as we're starting to see these new technologies come to market, it's this framework of a trusted app, which I know, people tried to put this in place a few years ago. It kind of fell by the wayside, but now, you've got to kind of bring that back again, but also just e-consent, right? And that consent that the patient's going to give, like, who am I going to share the data with? Does the patient really even understand when I say I want to share my record? Essentially you're sharing your entire patient record. Is that really what you want to do? And so I think, this trust and especially the e-consent, I think over the next year, we're going to see a lot of just kind of focus and, trying to people to understand and have to put some things in place in order to deal with that.
Lots of behavioral health issues too coming out of the pandemic, right?
Exactly.
I could see this just getting way out of control really quick. Jocelyn, you're deep in the middle of this new technologies and your role as a program manager for Da Vinci. Where do you land on some of this stuff?
So I actually want to talk about it sort of in three parts, because I think that where you and Pooja just left off is an important point, which is, and Ken alluded to this, right? If there's a business challenge that needs to be solved, we don't need standards in place. We can solve real world problems. And I'm gonna hang on that for a minute, right? To, if the problem is big enough, we can make the existing artificial barriers disappear, right? And whether people get paid for services matters. And we saw that with telehealth this year, right? I think the second thing that we want to look at is people are leveraging existing tools that are available to them. We kept having people come to us and say, what can Da Vinci do to solve this? And when you're in the middle of a pandemic like this, it's about what tools are there that are being underutilized. So I think, to Pooja's point, we really see the relevance of the HIE in these communities, the role of CCDAs to be able to transport information. And we see things like direct being picked up and used to get to all of these endpoints, not perfectly, but at least people taking advantage of what's there, which brings us to our new vector, which is the new tech, right? The AI, the unleashing of the data by using APIs, predominantly with FHIR. And we see, again, a push where I would look in my community and say, I had expected to see sort of native FHIR point-to-point APIs to go live, through probably a dozen or 20 partners this year. We are probably at about half that amount, real progress. And I put the vendors and the payers and the providers into two camps. Folks that were far enough along with their program that they could ring fence it and protect it, because the pandemic really clearly showed how critical these projects were. Right. And then the folks that said, I need to go stand up a FHIR server because I need to do the Saner project, or I need to get data to a registry. But that progress towards saying FHIR is the way to do this will allow them to come back this quarter and into next quarter more ready to do real work in starting to unleash the information. And then let's not forget, we're talking about the pandemic, that our friends at the feds keep literally dropping rules, right, across both our payer and our provider and vendor community. So we continue to see, this hand on the scale. It's not even a finger on the scale towards FHIR, towards API. And I think that this is a nonpartisan topic. I think whoever comes in to replace Don Rucker is going to be looking to keep that, metal, his foot on the pedal or her foot on the pedal, because, freeing data and solving these interoperability challenges is very much a nonpartisan topic, right? This is one of the few places where we're seeing sort of universal agreement from, some of the use cases that you talked about early on in the session. But I expect us to continue to push forward across, not just the pandemic related, but the existing challenges of interoperability around price, around prior authorization, continuing to predominate, 21, and people starting to have reg and make real progress and standing up early adoption of these new technologies.
Yeah, good point. Yeah, I think back to the Rumsfeld quote, right? You don't fight the war with the weapons you want, you fight the war with the weapons you have. Mm-hmm. And the folks that were wired up with American Well or Teladoc or whoever, any of the big telemedicine services, they were able to just go to burst immediately. And those payers and those delivery entities that lagged, that didn't have that in place, it was months before they got stuff in place, and they got hurt badly from a P&L standpoint, right?
But I would actually disagree slightly with you, because I do think that when push came to shove and we talked about sort of the complex telehealth module, right, where it's the payer walking forward with it with a third party doc, I think that that's true. But I also think that we saw out in the market small practices, regional practices, multi-specialty practices, and IDNs standing up really simple, low-tech solutions using existing tools that we're using today, right, to actually get patients through the door and to see patients. And it wasn't perfect, but, I got to do my kids' annual checkup via Zoom, and it was about as low-tech as it could get, but it was with our primary care doc. And I think people are seeing, being in front of the doc isn't the most important thing. And I don't know if we'll come back from that. I think payment will be the thing that drives how much we actually get to lean into telehealth moving forward.
Got it. And that's fair, until you're Zoom bombed during your physician visit, right? So good info there, everyone. So next, I thought we'd talk a bit about health data. The data group really seems to be getting its act together here. Medication, very good, right? They're doing a great job, all the pharmacy and the drug ordering and provisioning and all that sort of stuff. Also out there with a bullet, I think, is health analytics, especially around artificial intelligence and social determinants of health and Internet of Things. And we're seeing a lot of that, kick there. Jocelyn, you deal with a wide variety of data in your role with Da Vinci. Why don't you start us off here? What do you see happening with healthcare data in 2021 versus the underlying technology stack? Do some of these data sets hit the mainstream?
So, I think that the information and the push to free information for patients about themselves, I think is game changing with patient access APIs and the work that's happening with Da Vinci and with Karen and others to really use FHIR to free the data. But I take a step back and say there's a couple things happening here, right? The first is payers and the EHRs around the information blocking rule are mastering their information in a way they haven't had to, right, to conform with the standard and to really identify where that data is, right? An organization being able to comprehensively understand where their clinical information and their claims data is in a world where so much outsourcing has happened, so much partnering has happened under BAAs. And so I think what's been interesting watching the community is really understanding the scope of data that's under regulation, right? And having people focus, for good or bad, right, on meeting those initial regulations. But this massive curation effort that's happening across the industry, from payer to payer, from IDN to small doc practice, to say, what do we have and what are we on the hook to actually share moving forward? So I think that that's the first piece. And then I think the second thing that we're seeing is it's real. And there are people, I think, in two camps. There's the people that I think are getting their house in order. They're trying to figure out what their long-term strategy is as they move forward, really mastering this data. And then there's the other people, like has always existed in the industry, that are like, what do I need to do to check the box to get through this set of regs? Which, we've opined on is going to be challenging. And we're really pushing, at least for our clients and the folks that we work with in the industry, to really take a holistic approach about this is just step one of many steps everybody's going to need to take to get that data in a point where it's really portable, that you own it and can make sure that it's getting to the right end user at the right time, whether it be just to meet the patient access API rules or any of your trading partners over the next year or two.
Got it. Good thoughts there. Ken, playing off of that on health data?
Well, we're doing some research right now on terminology and code set management. This has been a topic that's been recognized certainly by providers over the last 20 years, and increasingly now by payers who are going to have to get a handle on the clinical data that they've got in addition to the claims data they have. They certainly have a need themselves for using that data together for risk stratification and for care management, case management. And now they're going to have to share it. And we've heard some concerns, to Jocelyn's point about, are they going to do just the minimum, or are they going to see this as a business advantage to, what do they share back to the patient, to business partners? And that is, I think, very exciting that we're going to do a better job with this, because in the past, even if you connected systems together, it wasn't much of an apples to apples. The US CDI, this core data is a step in the right direction, but it's just the core. It is a minimum. And when you think about social determinants of health, some of those topics you mentioned there, Gary, Internet of Things, all these additional data sources are eventually find their way into this US CDI and are going to help us to share information beyond just the very basics. And we're going to need that to do a better job, because as we know, it's not just about the clinical information that decides whether someone's healthy or sick.
Right. Prognosticate a bit further. US CDI, we've got 1.0 is out now. That's what all the rules are written to. 2.0, I think they've closed, right? Accepting ideas there, right? And that'll probably hit, I don't know, third quarter, fourth quarter next year, US CDI 2.0. What's going to be in that that's going to be, what could be in there that could be substantially different or game changing? Any thoughts?
I'll just say that it's going to be a continual process, and they're not the only group working on this. FHIR actually is very related here, and what terminologies get added to FHIR versus USCDI. They kind of leapfrog each other in a way, and they're going to be totally new areas that come into play. Certainly what we've seen with the pandemic has brought a new vocabulary into healthcare. People are always joking about, ICD codes and how they have a code for just about everything. Well, we need these codes if we're going to make sense of, this vast amount of data that's starting to arrive. So, the areas you mentioned, social determinants of health in particular, are a big part of this next wave of what we're going to be looking at.
So, Josh, want to add on there?
So I think when we look at USCDI in general and as a concept, I think it's directionally completely what we should do. And I think that, ONC has shown great leadership on high tech, I think is putting the structures in place to make sure that we can mature this thing, and that things that are standards-based always take longer than we want to, but I think being able to have directionality and sort of a known way to get this work done is important. But the reality is that this next wave of USCDI, we're hoping will address some of the deficits in some of the payer-based data. I know we have some guests from ONC coming up, and literally you'll watch them like cringe when they see me because I'm just like, get the payer data right in FHIR. But I think that there's maturity as new stakeholders, to Ken's point, come into the FHIR community that haven't been part of the clinical data exchange to date with FHIR. They'll be building out not just the data resources themselves, but also that ability to normalize the content through value sets and code sets. And that is incredibly important. And the community really needs to own and drive that. I think that will make a huge difference with us going forward. We have a long ways to go. And I think that we're at the beginning, and I often refer to the fact that we're on like step 3 of 2000, but everybody's moving in the same direction. So I'm hopeful from that standpoint.
I think of the terminology issues I had back when I was doing supply chain and automotive. And, the tier 1 supplier here calls this bolt X, and
it's no different.
Calls it Y, and the other one calls it Z. And, it's a 1.5 inch long bolt with 22 threads, and it's got a flathead top on it or whatever. Like, you had to normalize all that terminology. You couldn't get there.
And I think that there's big data, right, that will solve this as the data is unleashed and the AI is unleashed on it and the learning systems are unleashed on it. But then I think that there's the actual human one-on-one, I want to care for a particular patient and make decisions about this patient that requires a rigor there that the big data piece doesn't necessarily require.
Right. Good point. Pooja, want to wrap up this point?
Yeah. So the only thing I would add, we keep talking about claims and clinical data, but we have to remember that there's also pharmacy data, right? And I think to Jocelyn's point, right, with the with 2.0, we need to start thinking about those stakeholders that haven't been involved. And I think the pharmacy side is piece of that. I mean, we have things automated on the pharmacy side, but even if you think about payers that are now integrated with PBMs, they have such a powerful amount and a set of data that they could be really taking advantage of, right? You've got the medical, you've got the claims, you've got the clinical, and then you add on to that the pharmacy data, the pharmacy claims information. That's all you need for all of this. So it's just something that we need to keep in mind. And as we start bringing the pharmacy and PBMs along with on the ride as well.
So I'm going to put you on the spot here. You got these retail/insurance /PBM powerhouses out there, right? That was probably the biggest of them. You've got retail like Walmart moving into insurance, and delivery and health delivery. You've got other payers that have, like United, that have insurance moving into delivery, right, with their Optum subsidiary. How long before a Walgreens gets snatched up by one of the big insurers?
Yeah, I think we're going to be seeing things. I mean, even to the point that Prime and ESI and Walgreens as part of that, they're all starting to kind of come together, right, in different ways. So I think we're definitely in 2021 going to see more of this. I mean, you can see all the bits and pieces that are coming together. I remember, 6 months ago when these, when CVS and ESI and Cigna were together, it's kind of like, well, how's this all going to play out? But clearly people are seeing the advantage of having all the different pieces together. And, I think Jocelyn started out by saying, deliver the care where it needs to be delivered. And I think that's what we're seeing now with all these guys.
Got it. Good. All right, let's keep rolling here. I got two more topics I'd like to hit in our time here together. Next up, price transparency. Big, complex topic. Could be game-changing for the industry, given the recent CMS rules and lawsuit victories. Fed's won some big lawsuits here. So, Pooja, you got big expertise in this area. Why don't you start us off?
Sure. So, price transparency is, I think, my absolute favorite topic. And just thinking back to what we covered this year in the podcast, we started out with a conversation with RX Review, which is really kind of that original real-time benefit check transaction between the PBMs and the payers, right? I'm sorry, the PBMs and the EHRs. And honestly, it seems like old hat now because, that original transaction actually started in 2015. The original companies were Humana and Dr. First, that it's been in the market for 5 years. So what you're kind of dealing with there now is just making sure physicians are actually using it, right? They're enabling it and they're turning it on. Then we moved into the consumer facing, which is part of the Karen Alliance work that was done. We have a balloted implementation guide. We have a transaction that's could be in the market now. And we're actually seeing PBMs that are starting to pick that implementation guide up and start to look at it. The nice thing is it's not only just on the HL7 side, but it points back to NCPP code sets. So PBMs that have actually implemented it's a little bit easier. But I think the biggest thing we've seen is just in the past couple of weeks, and I know we also did a podcast on this, was just the new final rules that have dropped are for the payers and the providers. And I think that is really where we're early into 2021 going to see a lot of the traction. And, we talked about this on the last podcast, but payers and providers really need to be looking at this as a way to give themselves a market advantage, right? It shouldn't be something that they're being mandated to do, but really an opportunity for them to kind of stand out in the marketplace. But I think we're just so early in the whole price transparency journey, I guess. It started out, as I said, with just between the EHRs and the PBMs. We've now got a consumer, we're starting to see things around payers and providers, but I think we're going to be seeing in the future a lot more around this topic. And, if you think about it, it all relates back to value-based care and opening up the data and, putting more of that kind of burden, or not burden, but more of the opportunities in the consumer's hands to find the care that they need at a price that they can actually afford.
I made the comment to a client this morning, actually, around price transparency. I said, if you get to the middle of 21 and you don't have a strategy of at least how you're going to attack this, you're in a world of hurt.
Oh yeah, absolutely.
It's probably going to take a year to operationalize this, giving you current systems and things like that. So, Ken, thoughts on price transparency? Then we'll close this topic with Josh.
Yeah, we had a great podcast on price transparency just recently, and there were so many issues that came up. For me, the consumer can play a very important role here, but they've got their challenges. As was once stated, it would be great if consumers had medical degrees, and then they could correct the physician or tell the payer what they thought was the better course of action, but they don't. So how do you educate the consumer to operate in the proper vector? The more information you can provide them in a consumable way can make a difference. Lay out their options at least, and let them ask the questions. They may not know if the answer they're getting is the best answer or the right answer, but by asking the question, they're basically forcing the payer or the provider to pay attention to what they think, and that could lead to prices being held in check. And it's not easy to accomplish that. Now with copays and deductibles that are many folks effectively self-pay, We brought up issues like demand pricing and getting your MRI at 4 o'clock in the morning. If patients don't know they have that option, then how do they know to ask for it? So this is where I think, as it was stated just moments ago, you can try to get away with something here as a payer or provider and keep the patients in the dark, or you could use this as a competitive advantage and educate the consumer and have them increase the loyalty factor with you. And that's, I think, going to make a difference too.
Got it. I want to go to Jocelyn, but Jocelyn, in addition to whatever all you're going to weigh in on here, talk a little bit about the accelerators and price transparency, where you think it's going to play out. So go ahead.
Sure. So I'm chuckling because there's like 5,000 thoughts in my head about where to tackle this price cost transparency topic. So I jokingly in my head thought, oh, if it was a Facebook status, it would be, it's complicated. That's just it.
Very nice.
So to me, I think that, I think the name of the game here with price cost transparency is that it's patient focused. It needs to be patient focused, and that it's about information equity. To Ken's point, how can I run a calculator or have a tool that's going to give me the same information about the thing I need to have done at different stages of the progress, right? When I'm before diagnosis, once I've been diagnosed, once a course of action has been recommended, that is going to be equitable to the information that my provider has today. And that inevitably involves all of the players being involved. And I think that if we look across the board at sort of the sentiment of what's happening, that's really the forcing function I think that's coming out of the rules, is make the data available so that we can have the innovation that we need to get to a well-educated consumer, just like we are in all the other ways that we make decisions, right? So Pooja's been working on the real-time benefit check on the consumer side. Again, a lot more power and flexibility when the patient's directing their own care that simplifies, because it lives outside of the world of HIPAA, how this works. Patient cost transparency on the medical side, we're tackling at DaVinci. And candidly, it was supposed to be one of my 2020 use cases, but people were suing each other. So weirdly, we put it on hold. We picked it up this fall and we've been actively at work with it. And I expect the threads to pull across multiple accelerators in the industry in general. There's amazing work happening in the market, if people haven't looked at it, from a group of folks called PACES coming out of Brandeis. I know the American College of Surgeons has been actively involved. Franklin Polka has briefed us a number of times, that are really looking at this complex topic, right? You can get a price on a transaction, but very few things we actually do as members are single transaction episodes, right? So how do we really grapple with this idea of a bundle of services and be able to get to a point where, as a consumer, any one of us knows what our benefits actually pay for in a world, to Ken's point, of increasing co-insurance, really understand at what point in time in the year it's going to make sense for me to do something based on my spend, and understand the places I can get it done. And what we hear over and over again in all these discovery meetings is even all of us that are really experts in health IT and benefit management, struggling in our own journeys to really get visibility into that information, let alone just a regular consumer, trying to figure out where to go and get their MRI that's not going to cost them $1,000, but maybe it's going to cost them $250 out of pocket. So.
Right. I just sent a letter. I had some eye surgery done last month, as you guys know, and I just sent a letter to all the parties involved. And I said, this is what a consolidated bill should look like, because I got separate bills from the eye retailer. I got separate bills from the surgeon. I got separate bills from the anesthesiologist, the surgery center, the pharmacy, because I had to do eye drops and things and whatnot. I said, as a customer, as a patient, I'm extremely unhappy with this. This is what you should send me. And frankly, this is what you should tell me up front. This is what it cost, right? 2 of those bills I didn't even expect. They were like total surprises, and I'm in the industry, so I should know better. But okay, let's come off of price transparency. That was good set there. I think, to me, this is sort of the topic of the year for 21, I think.
Gary, I would venture that the word surprise billing is going to replace the industry jargon and focus point that burden reduction has had for the last 2 or 3 years.
Yeah.
That's my 2021 prediction.
Totally agree.
Good point. Good point. So let's wrap up with some thoughts from each of you around the incoming Biden administration with CMS. They just announced a head of CMS today, I think it was the California AG, who's going to take the role, right, gentlemen? So some thoughts around that. Where does CMS go? Where does ONC go? What should they be thinking about? And if you want to weigh in across, CDCs or any of the other sort of folks that fall into that world. So, Joss, why don't you start us off here? You're probably closest to the federal world, I think, between us.
Well, so I think to your point, as far as going across the sort of spectrum of the different participants from U.S. healthcare on the government side, I think that one of the great things coming out of this is that we all expect that public health is finally going to get some money to actually do real work, to build the standards that need to be built to simplify this. It doesn't change the fact that most of this work that needs to really be handled from a public health perspective is really down at the local level, really down to people's local boards of health. But being able to get out there and do real standards work, and we're seeing that happen, and we're seeing leadership across the board to fund that, an appetite to fund it in a way that just didn't exist pre-COVID. So I think that that's great. I think that we'll continue to see additional regulation. And as I mentioned earlier, this is a nonpartisan topic, right? We know we have to fix this. COVID has splayed open, our tolerance for really disjointed care, for decades. And so I think that we should come out of this with base level fire capabilities, shift towards API, really this commercialization, for consumer use of their own data, I think really will free the data and make it flow. I think sort of whose game it is to win is sort of leveraging and taking advantage of that. I think will be who moves the fastest, who actually accommodates not just the letter of the rule, but also the sentiment and the goal that our friends at CMS and ONC are really trying to accomplish with these rules. So that'll be interesting. But again, I see a transition, right, happening, and there being a momentum buster there. But I really am confident that between the work we see coming out of the ONC team and the CMS team around regs, and the work we're seeing of cross collaboration of those folks in worlds like the fire accelerators and high tech and groups like ONC Fast, all of the right puzzle pieces in place. And this is really fueled by staffers, right? There are political appointees, but the people that are driving this work, the brain power on the feds, our best and brightest, they're staying in place. Yeah, they're civil servants, and they're there because they want to make the world a better place. And they continue really now across 2 and going into a 3rd administration to make real meaningful progress in helping us as consumers, get better care, drive costs down in healthcare, and freeing the data so we can get the innovation that we've seen in all other industries today. So.
Got it. Very good. Good session, guys. Really, really well done, all of you. Thank you so much. And I appreciate it. It's been a great year with you guys. As you know, I'm going to wrap up my emceeing duties, and Ken's going to take over that. Let me give each of you kind of final thoughts going out here. Ken, since you're going to be the next Grand Poobah emceeing away, why don't you start us off here?
I don't know about filling your seat, Gary.
Final thoughts out of the year here.
2021 is going to be the most intense year in decades for health plans, for providers, and IT vendors as they start to tackle these recent game-changing open API regulations that are going to require them to share data. Competition surrounding price transparency, think about that. I mean, it's hard to play hide and seek with the lights on. And this COVID-19 pandemic, it's overwhelming our health system, and the worst is likely, unfortunately, still yet to come, even with the vaccine. We've got this huge backlog of elective surgery, as we've mentioned. Payers are coming off massive profits, many of them are, in 2020, and they're going to have an unprecedented opportunity to forge new provider relationships in this move to value-based care, which is a win-win. So I'm going to hold up my poinsettia and wish for peace and prosperity and advances in healthcare.
Very good. Jocelyn, closing thoughts?
So I think that we've never been better positioned to actually impact change. I often discuss the fact that we are in a unique situation with the move towards fire and APIs, and that it's rare to have an opportunity to fundamentally change the way an industry works. And we're doing that, and it's exciting. Sort of the ball's on our court to execute. I'm really optimistic. I'm tempered, however, by the fact that we are, to Ken's point, going into a period, where I think none of us can perceive and will be able to process just the loss that will happen in our country over the next 3 or 4 months, compounded on what's already happened this year, and that we're going to sort of, as a collective, process that. So I send people sort of my best wishes for being safe, being smart, doing the right thing, looking forward, like everyone, to 2021, and really making the most out of the opportunity that's ahead of us to really drive the change that's required. I think Ken hit all the high points, to really make sure that we take advantage of all of this hardship and that we come out a better, smarter, more comprehensive, interoperable healthcare system on the other side of this thing.
Very good. And Pooja, the forthcoming queen of 2021 there.
Yes, I had to put on my 2021 vision glasses, but I do have to have Jocelyn actually talk again so everyone can see the Be the Change little plaque that she has behind her. Because
my hashtag Be the Change. Yeah, I've been doing it for 20 years, way before everybody else.
Yeah. So, just as we look forward to 2021, I think Ken and Jocelyn said pretty much everything I would probably say is, I think this pandemic has definitely opened our eyes to kind of all the things that are wrong. I think it was kind of an interesting mashup, right? Like the CMS ONC rules that were coming out right at the same time that we were having to go in lockdown, having to share information. It kind of all came together. So, when you take a step back and you think, this really could have had these rules dropped earlier, had we had all this stuff in place just on our own without being forced to do it, how much of this kind of heartache and struggle that we're going through right now could have been avoided. And I guess my hope, and I was frustrated to see that the rules got delayed, because it's like, come on, guys, we're right in the middle of this pandemic. We should not be delaying anything. We should actually be speeding things up, right? And so I'm hoping that is the impetus to get people moving. And so, if God forbid anything else happens like this again, we're actually prepared. So, yeah, 2021, I think will be a little more sparkly and bright, hopefully. And we'll see. So
good, very good. Thank you all. You guys have been wonderful this year to work with. I much appreciate it. I wish Ken the very best. God knows it's not an easy job, reeling the rest of the folks in. We should have some great guests again next year. I know we're already lining up some of them for January, February. As we speak. So, well, that's it for our time for this edition of The Dish on Health IT. Ken, you'll have the reins going forward. Please support him as well as you have me, and perhaps I'll show up here and there as a special guest. Reminder also to subscribe to us at whatever podcast carrier you use, Apple or Google or whatnot. If you have any speaker thoughts, or if you have comments or suggestions on this podcast, please email us at podcast@pocp.com. Goodbye for now, and remember, Health IT is a dish best served hot. Good day, everyone, and Merry Christmas, Happy Hanukkah to y'all.
Does your organization need help making sense of how to respond to the latest price transparency rule? Point of Care Partners can help. Reach out to us to set up an appointment to talk through your unique challenges by emailing us at info@pocp.com.